the use of endpoints of clinical response versus overall survival in the evaluation of new drugs or therapies, and the time course involved in that evaluation if we don't change those parameters.
I understand the question. Mark, you want to do that? You want?
Sure, and I'm sure maybe Cliff would also like to weigh in on this. The endpoints that are used in clinical research sometimes have to be surrogates because it does take so long to capture time to event data and particularly overall survival data. But at the end of the day, the objective has to be improved overall survival, and so it's a critical endpoint, no question about it. And that's what patients want. It's what they demand. It's what they deserve. And so anything less than that is really unsatisfying. To embrace that notion, a number of the trials that are in progress now for advanced disease, even using new chemotherapeutics, actually use overall survival as the primary endpoint. And I think that's a good thing, because too often we have interventions that help only temporarily, but in the long run, the tumor can escape and catch up, and it's not really of meaningful benefit in terms of prolonging survival or even quality of life necessarily. And we have examples of that historically. So I think even though it's painstaking, it's time-consuming, and really anxiety-provoking, waiting for those data sets to come in, they're still absolutely necessary, and we have to support that kind of research in the future.
So I'll be brief, unlike me usually. I agree with Mark, but the only thing I would add is, despite the hype and the press, for example, in some of the popular newspapers, the FDA is actually fairly flexible. And Rick Pazdur, in the last 48 hours, was on record as pointing out that in certain conditions, a drug that improves quality of life or delays progression is acceptable to the FDA, just as long as it isn't associated with a worsening of survival. And the controversy emerges when there's debate about whether that's happened. I think it's all going to be sliding scale. We spoke earlier about treating vaginal dryness. The endpoint for that kind of a study is very different, for example, than the endpoint for a study of a very expensive drug with lots of toxicity. So I don't think there will ever be a single answer to that question.